person who's on medication, especially heart patient or diabetic patients on too many medicine, if they're taking only the first line of medicine like metformin alone, they'll be able to do the self-correction. And when their blood sugar is normal, HbA1c is come down to normal, they can come out of. There are so many patients coming out of medication like that. I had seen many, because after seeing the videos and they are understanding that how to control this thing. And if with only one or two medicine, only one disease, only diabetes or only hypertension, only and dyslipidemia, then they can come out of it with the self-lifestyle correction. And the patients also should be, those who are trying for that also, they'll be having reasonable knowledge and reasonable capacity to monitor also. But if you're on medication, on the heart patient, on so many medications, they actually undergo a clinical, with this medication withdrawal and all should be done with the clinical support. And in my way of clinically supported lifestyle correction, we are actually giving the optimal nutrition, optimal exercise, and reduce the toxin entering into the body. These patients who's having diabetes and hypertension, I'm seeing many patients will be using 3-4 medication for hypertension, a very high dose of statin, and maybe some other fibrin. Some other medication also is there for reducing the triglyceride, and they will be taking that too. And also insulin and 3-4 diabetic medication. And they'll be having fatty liver and so many other problems, and definitely gastric problem, gas and acidity and discomfort will be there because they're taking so many medicines. So in my experience, when we are doing with the clear roadmap and clear protocol, we are able to come out of almost all the medicines within a month itself. For this, especially for those who are taking this metabolic syndrome type medication. Only thing we are not able to, if the patient has put a stent, they had to use the blood thinners for a year. And also those who have put this pacemaker, the pacemaker, we cannot take it back because the pacemaker may be applied on the chest, but the leads are going into the heart. This wires will be wired to the heart. So in that patient, once this pacemaker put, you cannot take it back, and they had to use the blood thinners lifelong. Other medications, in my experience, on these cardiac patients, it's metabolic syndrome people, you can come out of medication, most of this within a month itself.